From my perspective, I think the areas that are evolving the most quickly are computational biology, bioinformatics, and machine learning, and I think we should be trying to adopt those tools and trying to develop more precise ways of diagnosing, preventing, and treating conditions in hepatology. And I would say that the content this year in this program really is evolving to adapt to those new tools and trying to help us learn about new strategies and new ways in which we can try to prevent and treat hepatology related conditions.
Well, there's rapidly evolving science going on in liver disease right now, and one of those areas is new therapies for treating NASH. And the program is highly focused on that area. And another area where the science is progressing rapidly is precision medicine and how we use omic methods to diagnose disease.
I believe the NASH, fatty liver, is the area that's evolving the quickest. We're seeing more and more patients with this particular problem, so I believe we're going to focus more on it in the future.
So I think probably the field of epigenetics in relation to looking at drug resistance for HBV infection.
Well, I think that a very important field is the transplant oncology, the area in which liver transplantation is applied for cancer patients. I think this is still an evolving field. There are a lot of discussion and problems to be faced. I think that we are starting a new area there. It's still not clear what we should do, but there are a lot of suggestions from this meeting.
The most important areas evolving are the liver cancer, where there is a lot of role of transplant, and in endoscopy in patients of cirrhosis. There are a lot of newer techniques which are coming, and we are learning about that. So I think those are the part most importantly are evolving.
I think obviously after some years with a lot of development within viral hepatitis, now NASH and AASLD is taking over. So I think the knowledge that we keep getting on mechanisms involved in steatohepatitis is really evolving quite rapidly, and that whole field is really something where there is a lot of progress. So by covering all aspects from basic science to translational research to clinical implications, I actually think that the whole spectrum is quite well covered at the meeting.
AASLD TV has all the coverage you want from this year's conference. Be sure to check out all of our content, which is updated every single day here on YouTube during the Liver Meeting in San Francisco.